Buoy Health Insights, Facial Numbness. Welcome to Buoy Health Insights. Today, we're diving into a common concern that may have brought you to our attention: facial numbness. This is when you're unable to feel normal sensations on all or part of your face. This sort of symptom can be pretty worrying, and understandably so. First off, facial sensation relies on a large cranial nerve called the trigeminal nerve, which sends signals that travel through the brainstem and are then interpreted by the brain itself. If there are issues anywhere along this path, from the trigeminal nerve through the brainstem to the brain, you might experience facial numbness. There are a variety of symptoms that could come along with facial numbness, depending on what's causing it. You might experience a tingling sensation and pain in your face, clumsiness, numbness, or weakness in your arms and legs, a spinning sensation, hearing loss, changes in your vision, enlarged lymph nodes in the neck, seizures, or even difficulty breathing. Now, let's discuss some potential causes and their accompanying symptoms. One, neurological abnormalities such as a stroke are a serious cause of facial numbness and can also lead to weakness, clumsiness, and numbness in other limbs. Tumors can also affect the sensory nerves, potentially causing a spinning sensation, hearing loss, and swollen lymph nodes. Two, physical injuries like facial trauma or injuries during surgery could lead to numbness, possibly due to damage to the trigeminal nerve. Three, other medical conditions, for instance, low calcium levels in the body, known as hypocalcemia, could cause tingling around the mouth. Scleroderma, a connective tissue disease, might also lead to facial numbness, typically accompanied by tingling and pain. 4, psychological causes might mimic the sensation of numbness without a physical cause, often identified through a thorough physical examination. If the numbness comes on suddenly, and especially if it's on one side of your face and/or body, with weakness, slurred speech, abnormal vision, and a sudden, severe headache, it could be a stroke or a transient ischemic attack, TIA. A TIA is a sort of warning stroke that doesn't lead to lasting damage because it tends to resolve quickly. However, it's urgent to seek medical care to prevent a more serious stroke in the future. Facing conditions like shingles can cause facial numbness accompanied by burning or shooting pain, tingling, itching, and blisters. Treatment usually includes painkillers and prescription antiviral medicines. Panic or anxiety attacks can cause intense feelings of fear and anxiety, often accompanied by sweating, a pounding heart, and shortness of breath. Treatment involves stress management, counseling, and sometimes medication, though some drugs may have dependency risks and adverse effects. Lastly, nose or sinus congestion can lead to blockage, nosebleeds, facial pain, or swelling. When should you seek medical care? If you experience facial numbness with symptoms like weakness in the limbs, slurred speech, vision changes, or a sudden and severe headache, it's important to contact emergency medical services immediately, as these can be signs of a stroke or other serious neurological conditions. Remember that while our clinical AI provides personalized health insight, it does not replace professional medical advice. If you think you're experiencing facial numbness, a visit to your healthcare provider is a good idea to pinpoint the exact cause and receive the right treatment. And before we wrap up, don't forget to stay updated on health insights like this one, like and subscribe to our channel. Take care, and here's to your health.